Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. We love having you on and picking your brain when it comes to this stuff. Let's talk specifically first about the Omicron boosters. This new study shows that the vaccines don't do a whole lot when it comes to this variant. Could this lead to a surge in breakthrough infections or even reinfections?
Well, I think a couple of highlights from that particular paper. One, the vaccines continue to protect people against hospitalizations and severe disease. What they are less effective against, as they have been for quite some time, are breakthrough infections and getting infected with COVID itself. I think we have to remember that the new variants that are arising, BQ 1.1, there's a whole slew of these, XBB, XBB.1. These are as different from Omicron B5 as B5 is from the original Wuhan variant. And so these are very, very new viruses that we're going at. Fortunately, the boosters are producing some antibodies and some effective antibodies that can neutralize these things, just not as effective against the XBBs and the BQs as they were against B2 and B5.
So to sum up, you might get infected, but if you are vaccinated and you are boosted, the likelihood of you ending up in the hospital with severe infection is pretty low still, right?
That's correct. And even in those numbers that you just put up, with the increase in infections last week by 50%, we still see a plateau in the rate of hospitalizations, which is a very good sign that hopefully we can avoid this large spike in cases again.
Always have to look at the whole picture, that's for sure. Well, research published this week shows that there is a link between a COVID infection and a really debilitating heart condition that has been diagnosed in some patients with long COVID, POTS syndrome. Is there a real concern here?
I think that there is a concern whenever you see an association between something and a difficult syndrome to treat. POTS syndrome, or postural orthostatic hypotension syndrome, is characterized by rapid heart rate, dizziness, fainting spells in people. And there is a small association between the mRNA vaccines and POTS syndrome. There's a much larger association between COVID infection and development of POTS syndrome. And so the researchers who looked into that study still said that the best thing you can do is to avoid getting COVID, which the vaccines are still very good at helping us get very sick from COVID infection.
Lastly, really quickly, the WHO says it's optimistic the global health emergency due to the pandemic can be lifted in 2023. What do you say about that? We know the virus is here to stay, right?
The virus is definitely here to stay. You know, the WHO obviously can't declare an end to the pandemic, just to the global health emergency. They feel that we're getting to a point where people have enough immunity in their communities, in their countries. We have treatments available that hopefully we can say that this isn't a health emergency, a world health emergency, and we can focus just on the endemic cases that happen in all of our cities.
We're in management mode at this point, it seems.
We're in management mode.
Dr. Hartman, we appreciate